Very clear. And it's recorded. I think you can go ahead now. All right. C-sections do not have to be so tricky. So we're here to give you guys so much free information about how to recover from C-sections. Let me just pull up the slides, but a couple quick notes. So we'll be taking questions as it goes on. You can type them in the question box, but we'll do the question and answer at the very end. And also stick around till the end because we have a special surprise for you at the end. We're just going to pull up the slides real quick. All right, so with C-sections, let's see. Do you need to do anything else? Okay, so with C-sections, there's a lot of things that we can do to prepare and help ourselves recover from C-sections super quick and efficiently. So I ended up being a 3-time C-section mama. So my daughter Brooke was breech. So we tried everything to flip her. Now that I know more, there's actually a little bit more that I probably would have done to try to flip her, but she just was not budging. And at the time I didn't know anything else. So she ended up being the first C-section. My daughter Avery, that was my chance, my redemption song to do my VBAC with. And she ended up being a week late. So the medical team and our family decided that we were going to do another repeat C-section. With Camden, I had no choice. So my background is orthopedic and women's health physical therapy. I became interested in women's health because I just felt like there's so much information that people are not getting. And so that's why we're so excited to be doing the webinar today. So starting with recovery, I always tell patients that you only have one opportunity to heal correctly. And so with this, we're trying to give you guys the most information that you have so that your shot of healing is the best that it possibly can be. So why you would care to like do it the correct way is how the scar looks, decreasing swelling that helps with pain and inflammation at the time of a C-section. Also, a cesarean section is cutting through the tissue, right? So it's cutting through muscles, the fascial system. It takes a little bit more to recover. And then also reconnecting with our brain and our abdominal wall to be able to control pressures. C-section moms are more likely to have what's called diastasis recti or DR because there has been trauma to the abdominal wall. So these pressure issues can be a real problem for C-sections moms as well as low back pain and other orthopedic problems. So in preparation for a C-section, there's actually a lot you can do. It seems like that there's not a ton of things to do when there's a C-section, but there's quite a bit. So the first step is talking to your physician. If it's a planned C-section, it's really nice to have a conversation with your physician prior to the C-section. So after my first, I realized that there was a lot of scar tissue involved. So before my second C-section, I asked the physician, like, would you mind taking your time to close? They do a technique called undermining, which makes a C-section scar look a lot better. That creates less tension on the scar. So just giving them that gentle reminder or push that he or she might need to help know that it's okay to take their time to close. There's other factors that you can control as well, such as having a clear drape so that you're able to see more. During the C-section, it's really important to be telling your medical team how you're feeling, what they're doing, because there's a lot of things that they could do to help you. So for example, sometimes people will get nauseous or dizzy or not feel well due to the anesthesia. And so with that, they can give you more medication. They can put lavender oil. They could put towels on your face. So again, it's really important that you're always telling them how you're feeling. You know, like, I feel like I'm not going to feel well. There's things that they can do to assist so that the experience is more enjoyable for you. As far as the baby goes, there's also a lot you can do that for that as well. So for me and my medical team, I told them that I wanted baby skin to skin as soon as possible. So they usually will swaddle them up and wrap them up. And then I preferred to have the kids given to me without anything on. And then I would also pull my hospital gown down so they could be on my chest. Actually, with the second two babes, I breastfed both of them while they were while we were in the hospital. And the reason because is sometimes with the medication, C-section babes have a little bit more difficulty breastfeeding or initiating that because they're a little bit more sluggish because they've gotten some of the medicine as well. So putting them skin to skin, if you feel comfortable, breastfeeding while you're closing is always a great option on the table, or possibly delaying their cord clamping right when they come out. So as far as things you can do for home and to get ready for your C-section, there are a few different things that you're going to need that you wouldn't need in a vaginal birth. So compression garments are definitely a must for C-sections. Whether these are underwear and or leggings, a few of our favorite things come from Bay. They have underwear and postpartum compression leggings. So you can check those out. Also, silicone pads or adhesives. These become really helpful to put on the incision site as it becomes later in the C-section. It helps to create a moisture barrier where the C-section scar can kind of pull away from the skin a little bit better. So these are really easy to pull on, and I call them like a quick and lazy way, but easy way to create some mobility in the scar tissue. So we'll go over that a little bit later as well. But the biggest thing, and one of the things that I struggle with the most, is always asking for help. So asking your partner, like, hey, do you mind carrying the car seat? Hey, do you mind carrying this? Do you mind grabbing the baby? I want to feed the baby. Asking for partner assisted when you go from sit to stand. Also knowing if you have stairs, there's ways to do energy conservation. I would always avoid doing the stairs if possible. So even if your bedroom's upstairs and you're downstairs, if there's a guest room, staying in the guest room over that time. Otherwise, you could keep a basket at the bottom of the stairs so you don't have to go up and down the stairs all the time, or have somebody carry things for you. Having somebody to help prep meals, not denying when friends want to come over and either drop off a meal or hold baby for you. And then really doing your homework. In the postpartum guide, one of the things that we are really proud of is that all this information that you're hearing here today and more information is in that. I think the intro is like almost 30 to 40 pages long of information that you guys just aren't getting at the hospital and need to have for preparing the best from C-sections. So here's a checklist. This is a great checklist of those things that we just talked about to have on hand before you actually go through with the C-section. And then also things that you might need at home are definitely stool softeners. Magnesium helps with softening the stool. We'll talk about this in a bit, but going to the bathroom after a C-section can be really cumbersome and scary because it's painful. So keeping our balls as soft as we can is so helpful. Another thing with that is hydration and great nutrition during that period. So I always made my own food to take to the hospital with me. I just kept it in their little fridge there for the C-sections. And that way I pick and choose what I was eating off of the hospital menu. And then having a desensitization kit made up if you know you are having a cesarean section, and we'll go through that in a second here. So again, the things that we'll go through that will really set you up for success are how and why you should control that inflammation, how to move smarter, and that creates less scar tissue, it creates less pain, and it helps expedite your recovery from a C-section. So from day one, it goes back to the basics. You really need to start with the basics. So rest, ice compression. It's just like if you have an ankle sprain, this is a major surgery. So you're going to ice way longer than you ever think you need to. And that ice should go on at least 4 weeks, doing it 15 to 20 minutes every couple hours. The first weeks of your C-section are really going to help. So in the hospital, I often ask my nurse, like, hey, do you mind refreshing my ice pack? Once I was up and moving around a little bit more, I would go do it myself sometimes, but making sure that you have a fresh set of ice on you often. And it helps so much with controlling that inflammation, bringing new healthy cells into that area so you're not seeing swelling, and decreasing the risk for complications. Rest, of course, you say newborn and rest are usually don't go together, but finding those little gaps of rest when baby sleeps, really you should be sleeping or sitting down. Making sure with that compression, that's nice too, because the ice can stay inside your compression pants. But I usually would wear the compression garments literally, if not the first day, definitely the second day in the hospital. And sometimes you can wear them and then take them off for like an hour break. Wear them again, take them off for a little hour break if it feels like it's too much, or pull them down for a little bit. But that compression is really going to help control some of the inflammation. Same again with having anti-inflammatory foods. That's going to help control the swelling, which helps decrease pain, hydration, those stool softeners that we just talked about. And then so now I feel like I really have this ticking down, but staying on top of your pain meds. I'm not a medication person. So the first C-section I had, I wanted to do it with as little meds as possible. And then it is a major surgery. So I really paid for that as the C-section went on. So the second one, I was able to take the medication better so that I could stay on top of or control the pain. With NSAIDs or non-steroid anti-inflammatories, you're going to want to take those as well, at least for 2 weeks, because that's going to help, again, control some of that inflammation. The name of the game for the scar tissue to not get as big as it could is controlling the inflammation, gentle movements. So this gentle movement piece is really important, because if we just stay stationary, we're not bringing new blood flow in and new healthy cells. This also helps reconnect our brain to our core. If you think about it, we have had a baby inside us for a long time. So the abdominal walls are stretched out. There's been excessive pressure on the pelvic floor. Often people think that C-section moms don't have pelvic floor issues, but you also had to carry a baby for a significant amount of time. So sometimes you might not have the tearing that comes with the vaginal delivery, but there can be quite a few complications with pelvic floor problems after baby. So when we're thinking about ramping up that initial core system, the pistoning system, it's comprised of our diaphragm, our pelvic floor, our abs, and our back muscles. So it's not just about the abdominal muscles. And it's really important because we want to be able to start connecting with this stuff right away. The more that we feed our brain good patterns, the better it's going to start to incorporate this into our activities of daily living. So some of these things also will come or they won't come automatic. So we really have to reteach. It's relearning the pattern after baby comes out, because we have completely changed some of the biomechanics when we're pregnant. So with this, we really want to be conscious of stacking our ribs on top of our hips and having that nice deep inhalation. The inhalation allows our pelvic floor to relax. And again, getting blood in and out of that area. So inhale, a nice deep inhale, and exhale, you're thinking about scooping up from the bottom up and allowing air to come out of your mouth. The reason you want to scoop up from the bottom up is our air usually, or pressure usually tends to go to the area of ease. After a baby, sometimes that's the abdominal wall, because again, that area has been stretched out. There's trauma to that area. But to minimize that little mom pouch at the bottom, or a lot of C-section moms have a hard time getting their lower abdominals back, as well as decreasing prolapse or incontinence, things like that. We're really making sure we're exhaling from the bottom up. So walking, this starts day one. So even with the catheter in, you can try to start just standing either with a walker. I often would use the baby bassinet without the baby in it sometimes. And when we're standing, we want to think about getting into that more erect posture. When you have a cesarean section, your midline feels like it wants to be pulled over like this. So it will help with the scar if we're standing more straight up. And this is a really slow process at first. So in this picture, once you get home too, you're really pressing through the handlebars to create some extension in your spine. We want to elicit natural movement. Sometimes this can be a little bit sore. It can be really tricky to recover from a C-section because it's painful. And sometimes you don't know what's good pain and what's bad pain. So when we start to walk further on, we're thinking about rotating our chest. So rotating from side to side. If I had a flashlight in my sternum, that flashlight's going from 1 to 11, 1 to 11, and we're starting to get back that natural movement or pattern. But in the hospital, it's just short little walking. In the postpartum guide, we lay it all out for you, how long you should be walking. And again, when we're talking about that pissoning system, you're thinking about getting tall. So almost like somebody's pulling the back of your hair straight up towards the ceiling. We're getting really tall and erect in our posture. All right, functional activity. Everybody after a C-section needs to know about this. So getting in and out of bed, sitting from standing to a chair, getting in and out of a car, even coughing, laughing, sneezing, and pooping can be painful. And again, besides the pain, we're really trying to minimize impact or irritants on on the C-section area. So let's go over the log rolling here. Okay, so with log rolling, what you want to do when you're getting into the bed, the hospital bed, you're going to kind of see that railing coming here. You want to put your bottom where you want your bottom to end up. If I start really low, I'm going to have to scoot up really high. So you want your bottom exactly where you want it to be. I'm going to sit down, then with my hands, I'm going to press through with both hands and scoot my butt backwards to the edge of the bed here. In the hospital, you could raise the bed up to make this a little bit easier for you so you don't have so far down to go to really minimize that. Now, when you log roll, I'm going to put this arm down. At the same time, I'm going to bring my legs up. The whole goal is to keep my chest and my hips in one line so I don't have to use my abdominal muscles as much as possible. Then I am going to lay down with this, and then I'm going to roll backwards. So this shoulder is going to drop backwards, and I'm going to start pushing with this foot back like this. And then I can be in the bed where I want to be. Now to get out of the bed, you're just going to reverse that. So I'm going to use this hand to reach across, and I'm going to use this foot, and I'm going to push through the opposite foot and reach with the hand. In the hospital, it's so nice because they have the grab bar there, so it makes it so much easier for you. Then I'm going to press down with this elbow and then bring my feet off of the bed like that so that I'm able to stand a little bit easier. At home though, in the bed, it can be really a lot more complicated if it's squishy. So a partner could stand there and their job is only to apply some resistance as far as having a supportive hand, and then you're able to push through. So as I come up from the sideline position, if I had a partner there, I could also push with my upper hand into their hand so that I can push up and under the table. As far as going sit to stand in a chair, what that looks like is you want to find the correct chair. This is like finding a spouse after a C-section. You want to make sure they're right. So in a chair, you're looking for a harder surface. One that has arms is a bonus, and one that's not really low or deep. Low and deep is going to be really hard to get out of, and it makes your abdominals work harder. So once I find the chair, I'm going to sit down. I can use, again, my hands to pull me back in the chair. I also, if I'm shorter, I could use a pillow here to support myself. When I get out of the chair, what I'm going to do is I'm going to go towards the edge of the chair. So I'm going to scoot, scoot, scoot. Then I'm going to tuck my feet underneath me. You really want your feet underneath you. And then nose over toes. So I'm going to press with my hands, especially if there's armrests. And then that way I can use my quads to get up nice and slow so that I don't have to engage those abdominals. Often in the hospital, I would breastfeed a lot in a chair. So instead of in the bed, it's really hard on C-section moms because your legs are extended outward. And then that's a lot more of this like forward flex position. So often I would even get out of the bed, and that's great for some mobilization, and then find a chair in the room that I could feed in. As far as going home from hospital or being in the car, this can be really tricky too, especially in higher cars. So if this were the car door here, what I want to do is I want to sit my butt down and then I'm going to press back. I can do that through my hands or the grab bar here in the back of the chair. I can press my butt back. Then I'm going to take my legs and walk them slowly, like step, 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 keeping my knees together the whole time so that I can walk myself into the car. Again, you could use the grab bar a little bit to help you assist you into the car. And then we'll sneak back to the slides here. So as far as mobility, it's really important in the hospital that you're up and moving as quickly as you can, and you're not going very far when you do that. So here's some slides just for reference about getting in and out of bed, up and out of the chair. Okay, sneezing and laughing. My first pregnancy, C-section recovery, we tried to watch a funny movie after she was here. Bad idea. That hurt so bad. One thing that you can do to help yourself is called bracing, or you could also try what's called a knack technique. So with bracing, I'm just going to take a pillow or a stuffed animal or something where I can squeeze a little bit with my arm. So I'm just pressing in towards my sternum or chest and then hachoo, sneezing or laughing. So that way that you can take some pressure off of the incision site. You could also try just activating your pelvic floor a little bit. And again, we're trying to minimize that pressure from going downward onto the incision site. This can be also helpful when you're pooping. You could use the same exact technique where you're using the pillow out in front here, where I'm just squeezing the pillow and then lightly pushing. A lot of these things are going to be the same as regular pooping. We want to exhale like we're blowing out birthday candles. And we want to have a great setup. So in the hospital, sometimes they have squatty potties. If not, you can take a garbage can and flip it onto its side. That propping of your knees above the hips is going to help make stool come out easier in that position. So again, aggressive hydration in the beginning because of the pain meds can make you severely constipated. And then sometimes just taking a stool softener to avoid having problems from the get-go. If you're having a lot of pressure on the downside too, what you can do is wrap toilet paper around your finger and you can help splint the front area. But often the most painful part for C-section mamas is going to be that like insane incision pain as we're pooping. Okay, so nerve desensitization and scar tissue mobilization. These two are two completely separate things and used for different reasons. So scar tissue desensitization is used for because they cut through the skin or the cutaneous nerve endings. Our skin sometimes doesn't match the surrounding skin. So the skin feels different. It might feel tingly. It might feel like kind of an icky feeling as somebody grazes their hand over the top of the C-section. So we want our peripheral nerves to start to grow. What we can do to help them is create a nerve desensitization pack. You can see these things here. All you have to do is take different textures. It can be really light, fuzzy things. They could be towels. It could be burlap. All these different textures are going to start to stimulate the nerve endings so they grow quicker and better. So at first, you can do this day one, but you're going to go around the incision site. So if my C-section scar is here, I'm just going above it and I'm rubbing it 3 to 5 minutes. It only takes. I often would do this when I was nursing. And you're going to continue this till your skin feels like it's the same as all the other skin around it. It doesn't take that long. And the quicker you do it from the get-go, the quicker it expedites the recovery and comes back. I also think too, when you start to touch the C-section scar around the C-section scar, this helps us kind of recognize obviously that the scar is there and helps feel like a little bit of the emotional healing. So this is something that's often not talked about, but sometimes people will avoid this area because there was trauma or they're not feeling comfortable with their C-sections. But the more we jump on this, the quicker it can be really easy to get this area to match the other tissue around it. And then one last thing about that is it might feel really weird at first, or it might feel like it's actually irritating to do it. And that's exactly what you want it to feel like. You want it to feel like it's stimulating the nerve fibers. So it's bringing awareness from the brain to this area to help expedite recovery. So it might feel a little bit funny. And then C-section scar management, completely different than nerve desensitization. So what this is anytime that we have a scar, whether it's an open heart surgery, a C-section, there is scar tissue created. When there's adherence in scar tissue, it can create differences in our movement patterns. It can create differences in the organs below, like our uterus, the fallopian tubes, ovaries. So it can also restrict or make subsequent pregnancies a little bit trickier. It can also lead to chronic hip pain, pelvic pain, all kinds of different things, changes in your GI system. So not only is it functional, but from an aesthetic standpoint, this is where we tend to get that C-section scar shelf. And again, sometimes it's not just about doing the C-section scar mobilization, but you have to take into account genetics and then the surgeon. So if the surgery was a little bit more of an emergency, the techniques that were used are maybe a little bit more aggressive, so it's harder to get back this area. So how do we do this? This has different steps, but what we want to do is we'll pull this so you can see a little bit better. So when they do the cesarean section, they're cutting through multiple tissues. So the skin, the fat, the adipose tissue. And do you see how these little C-section scars will go deep into these other tissues, causing restrictions? So what we want to do is we want to mobilize the tissue. I'm going to go over my C-section scar. So when I start, all I'm doing is lightly touching around it. So at weeks 4 to 6, the goal is just to start lightly touching around, making small circles around the incision site. So I'm not even touching it. Now remember to go below too. There's muscles, superficial muscles in the pelvic floor, and some of those ligaments that we need to have touched lower. Then what we're going to do is we're going to start to go through the middle of the scar next. So we're just going to hold our hand and then move across the scar like this. We can bring the scar into a circle. To be the most efficient, you're going to lock it up in 3 different directions. So I'm going to assess my scar. I'm going to go up, down. Mine moves down really easily. So I'm going to keep my restriction on up. And then I'm going to go left and I'm going to go right. Mine doesn't move this way. Then I'm going to try to twist it and untwist it this way. Mine has a hard time going this way. So now that I have that twisted up in the middle, I can either bend my knees here and start to move my legs left to right with my knees bent. I can also just hold that C-section scar and start to breathe in and out, in, because then we're getting movement from behind the scar instead of just us always pressing down. So I'm going to go through and I'm going to assess different parts of the scar. So when you first start, this might look or feel aggressive. If this feels threatening, I always think sometimes just starting by touching the scar. So just a couple minutes each day, just touching the scar and feeling comfortable with touching the scar once the scar has fully healed. Then I can take a towel and even put it in between me and the scar. So if I don't like the way that it feels, I'll just take a little hand towel from the bathroom and put it in between. This helps with the sensation on our fingers, gives information to our brain, and our skin around the C-section scar also does. Because this skin is affected, it might be giving 2 different signals, so it makes it feel really weird to touch your own scar. Otherwise, having a women's health physical therapist can be really helpful if it's hard to touch your own scar at first.
So once we've assessed and gone through the center, at 10 weeks to 12 weeks, we can start pinching the edges of the scar tissue. So I can pinch those edges together. We want to stay away from the left and the right side of the scar until that's really fully healed, because that can create hypertrophic scars where there's just a little bit more scar tissue if we start the ends too early. So again, we're just starting around the scar at first, very light, gentle, just getting some movement, breathing into the scar, exhaling. Then we're going to start going across the middle of the scar, so we can just pull and hold like this across the middle. We can find very specific points in our scar that we want to release. And then we definitely do want to get the ends moving, because those can be tricky, but not too quickly. We'll do more on this in an advanced course, but another way to do this is through some more aggressive movements. So as the C-section, as you're further out and you're having trouble doing this, using a half foam roller can be really nice, because then I can drop my pelvis back and forth like this. So if I had a clock on me, 12 is up, 6 is down, I'm just rolling my pelvis. So what I do is I take my hand and I'm going to find the restriction on the scar, and then I'm going to try to roll my pelvis towards that 6 o'clock position. See, when I take my hand off it, how it's so easy for me to roll down. Again, I'm going to hold that C-section, and then I'm going to try to move away from it. And so I can go through and do this. I can also roll my legs side to side, because this is gonna change where my sacral position is. You can also use more aggressive techniques like cupping, and this is probably definitely like 6 months out or so. So this thing has fully healed, but I can use cupping techniques. So these are little silicone cups. You can get these off at Amazon. All you do is press this cup so it looks like a pair of lips, and then I go ahead and I put that on the C-section scar. If that doesn't work, sometimes you can use a little bit of vitamin E, coconut oil. I can either just hold that there. The nice thing about the cups is pulling the tissue outward. A lot of times when we're doing the C-section scar manipulation, it's only pressing inward. And again, C-section scars are like roots of a tree. You only see about 10% of it on the surface, but a lot of the scar is down below in those other layers that I just showed you before. So I could just move the cup. This is nice because I don't really have to do anything. I do this a lot with my C-section scar at night, but I'm just putting that puppy on there, letting it hang out, or I could move the cup to side to side.
So the other thing after a C-section is really starting to do some of the mobility things. So starting to get back to activities. I like to say with the postpartum guide literally starts day 1, week 1, and it's telling you things to do. If you think about it, there's many things that we're already doing, whether we've been quote unquote cleared for exercise or we haven't. We're still having to lift baby, we're still having to feed or care for baby. So we really want to make that brain body connection happen again. And the best way to do that to start with is breathing. So really breathing into that diaphragm. If you think about it, our diaphragm has been squished up because of baby, and now we have a C-section scar that's like making our brain think that we don't want to breathe down, because it creates movement and a little bit of discomfort sometimes. So when you're breathing, you want that breath to be a 360-degree breath around the ribs here. So area of ease is usually always going to go to belly first, but we could start in the C-section focusing on side body breathing. So either when we're laying on our side with baby, or just throughout the day, you're thinking about breathing into my right side, into my left side, and then into my back. So I'm really starting to reconnect this area. I can do really nice light movements of hips in, hips out. So we want to start doing that before we even start exercise. Around week 6, we can have more core strengthening. We always want to start exercise symmetrically, so our brain doesn't have to be overloaded by like one pattern, then the other pattern. So starting with squats, unweighted, body weight, there has to be a certain progression after C-section so that we can make sure that we can do tons of different athletic activities into the long haul. At week 12, we're starting to add more of that upright, impact, diagonal, unilateral activities. But again, it's a huge progression. The postpartum guide goes 8 months because it really does take so long to get everything going again. So this is what that initial postpartum guide looks like. It changes throughout the whole guide, but here in the first couple of weeks, you have a lot of breathing and just gently moving. Again, the scar is going to be so sensitive. For me, it always felt like the first couple of weeks, you're like, gosh, dang, is this thing going to feel any better? This is so painful sometimes. So doing these light movements can actually make it feel better. Sometimes if you have a headache or a low back pain, if you just move a little bit, that will sometimes assist things in feeling better. Same thing with this C-section, not too much, because the initial weeks 1 through 4 are all about resting, but just these light movements are really going to help us reconnect with our body. Again, this thing progresses on itself. So we're going to slowly start doing more things. Our backs become really tight in a C-section because if you think about that canister, the abs probably have the hardest job as far as healing after a major surgery. So the back muscles will usually take more of the load. It always felt like a lot of back extension stuff was needed. My back just felt so achy and sore. So one tip would be when you're at home at a countertop, I can press through the countertop, literally letting my legs be dead weight and kind of just creating some self-traction in that position can help a ton. Starting to master the hip hinge as well. And that initial postpartum period is going to take so much pressure off your back. And we'll go through that here in a second. So initially, we just want to create nice, light, gentle movements. What you'll see in the first couple weeks is trying to create that pelvic clock. So moving our pelvis this way and that. With a C-section, the pelvis often will drop into what's called an anterior pelvic tilt because that takes a lot of pressure off of this area. But we want to try to tuck our butt underneath us and get into that posterior pelvic tilt. Pelvic clocks can be really helpful. You can do this on all fours. You could do this even sitting or standing. And then for the abdominal wall, we want to reconnect to this area. So we could do what's called muscle pumping, which is light activity. We're doing light contractions of the abdominal wall and the pelvic floor. So what I mean by this is even right after a C-section, and I'm talking about a 30% contraction, this hip to this hip are pulling in and up together, and then I'm letting it relax. In and up, just the gentlest squeeze ever. And you can wait a few days until you start this, but letting it relax. Gentle squeeze, let it relax. This helps bring new healthy cells into the area because it's increasing the blood flow in that area. Now, if you haven't had if you didn't go through labor and delivery and experience a lot of the pelvic floor trauma, you can gently squeeze the pelvic floor, relax. Squeeze the pelvic floor, relax. These are all also going to be helpful exercises into getting the abdominal wall back. So hip hinging is huge. When you're picking up baby, even getting your brain to understand this. So what hip hinging is keeping my back straight. If I had a rod in my back, that rod is going straight. I'm thinking of myself getting tall from the back of my head all the way up, and butt goes back, almost like I have a tail attached here, and I'm thinking about my tailbone going up and out. So I can practice this. I can go about a foot or two away from the wall and just tap my butt on the wall. Stand up, tap my butt on the wall, stand up. So these are just small little movements that will really help with that recovery. The hips are huge in taking pressure off of the C-section scar. So being able to move our hips are a ball and socket joint. They don't just move into flexion and extension, which you see in squats and lunges, but we really want that internal, external rotation to start working again. And that's not a natural thing. There's moms that I see that are like 20 years out and still have lost a lot of the what's called internal rotation. When we are pregnant, our legs naturally kind of turn outward to increase our base of support and also make a little bit more room for a baby and to support our bodies as the weight comes increases in the front. So to get this guy back, we want to start that right away. This is called happy start, but I would just stand on one leg and I'm rotating inward, exhaling, rotating inward, exhaling as I stand up. And again, with that sore back, doing back bending, so pressing through a surface. I would do this a lot in standing by a countertop. Like if I'm brushing my teeth, I could just do tiny little back bends, and as well as laying on your belly that you see here. Same thing with bridges. We're going to start creating these hip extension moments. Our hip is going to be stuck in flexion, and that's kind of going to be its default after a C-section. So this is really important to start engaging your glutes, decreasing the load on your back, and getting that abdominal wall to fire. Okay, so upper body strengthening. You wouldn't think that this is a big deal in a C-section, but it is so much. Upper body strengthening really starts during pregnancy though. So as you prepare for a C-section, strength takes about 4 to 6 weeks to build. So we want to be doing these upper body strength training exercises if we know we're having a C-section before we go into that. This is going to help me bring my shoulders back, stacked over my hips, so there's less pressure into the C-section scar. Also, the stronger my arms are, the more pressure goes through my arms instead of my core when I'm holding baby, carrying baby around, trying to deal with a fussy baby, birthing baby. So that postural strength training is going to be huge for taking off C-section pressure, as well as you recover. Sometimes people think about the abs only being from the bottom, especially with C-sections, but our abdominals attached to the lower ribs. So we also want to make sure that our ribs are in a great position as that abdominal attachment goes in there. So we are getting prepped and ready for the Mother's Day sale. We wanted to make sure that everybody on the webinar had the opportunity to take part in that before the sale actually kicks off. So if you use the code MAMA on expectingendempowered.com, you can get 25% off any of the products on there, including the postpartum guide, which we talked a lot about, the initial recovery, which is in the intro to the guide. And also there's a different section for vaginal recovery and cesarean section recovery in the guide. And then as well as the 8 months postpartum. Anybody that buys the physical copy during the sale also gets a free circle band, whether that's just the physical copy or the bundle. So now we just want to take questions. Okay, so a couple of them here. How long should we avoid stairs? Really, we shouldn't be doing stairs as much as possible, but for 3 weeks or so, if you can avoid them, that's the best case scenario. If you can't avoid them, what you want to do is you want to face the stair. So if these are my stairs going up like this, I might, Kaylee, if I just pop this on. Okay, so if I'm going up the stairs like this, instead of going up, when I go up, I have to activate my abdominal wall. So I could use my hip muscles to go to the side. So I could step up the stairs, use a railing in front of me to step up the stairs. But again, that's one that you really want to avoid if you can. Icing, dude, the hospitals, that's why we're doing this webinar. Often I see that they don't tell you much of anything. So I wasn't given instructions on how to move in bed. And when you ask a question about, should I be icing? Do they offer that? Do they tell you? No, sometimes I didn't have that. So you have to kind of direct your care. So that goes every 1 to 2 hours for the first couple weeks. And then even when you get home, even when you feel good, you still should be icing. We just had one of our office admins had a baby and hers was vaginal, but I got so mad at her because she didn't listen to any of our advice about like the icing. Your tissue still has a lot of healing to do, even if you feel well. So this is especially important when you start to feel better with these cesarean sections, that you continue to ice. There's a question about VBACs. So, and in preparing for C-sections. So VBACs are typically really safe to be doing. Obviously, this is something that you want to talk over with your healthcare provider and understand why you had a cesarean section in the first place. So my first one, my daughter was breech. there was things that I could do to try to flip her to avoid the C-section. In my case, it didn't work. So if that happened, maybe knowing, well, there could be a decrease in the amount of room in your pelvis. So when baby comes out, there's a pelvis inlet and outlet. So it has to be able to fit through this space. This is anecdotal, so don't anybody get mad at me or ask for a study about this. But often what we see in the clinic is endurance athletes, runners, impacts, like lacrosse players tend to have a lot of hip tightness. And when we wind up the hip, that winds up the pelvic floor. So sometimes having a tight pelvic floor, which would decrease the amount of space baby has to come through, or tight hips, can lead us down to have a cesarean section. So in order to prep for a VBAC, what we want is we want these hips mobile, the pelvic floor mobile. For the hip mobility, we're looking to strengthen and stretch it. We could also use a practitioner, like in our clinic, we do dry needling, which is a needle that goes deep into the hips to release the tissue. The hip muscles are really thick and beefy. They're strong. So it's hard sometimes to get to those areas. You could also foam roll out that area. And then as far as the pelvic floor, stretching this out, you can internally stretch it before pregnancy. So at like 32 weeks, we can start to insert our finger into the vagina, pull back, down, hold, and stretch. Also, we can lay on our side. This feels good, whether you're having vaginal or a cesarean section, is going into our butt bone here and pulling up. So again, those pelvic floor muscles attach on these different sides. So what that looks like laying down is if I lay on my side, I'm just going to put my hand underneath my butt like this and lift it straight up to the ceiling to try to create some space. Also, in our clinic, we do a ton of like pelvic floor and cesarean prep. So a lot of our patients will be coming in and they're coming in exactly for that. So as far as the leggings, Bay is pricey. They're usually well worth it. I know there's it seems really expensive. There's a markup on those. Sanita, I haven't seen those in person, but I do know they offer compression. And that's the only other one that I know that might be a little bit cheaper. But again, I don't know for sure if those are amazing. Okay, how can we keep from passing gas? So this, I think that a lot of that goes into the prep work. So making sure that we have the cleanest I ever eat is right before, after my C-sections. On my third one, once I started eating kind of like my normal stuff, which might include some inflammatory foods, I got severe gas pain where I had to go back into my physician, and I thought like my uterus was not doing well. And it actually was just the gas pain from reintroducing some of those foods back in. So hydrating foods, gentle movement is going to help with gas as well. So getting moving. I know after C-sections, a lot of times people are scared to move, and I totally understand because it can be very painful. But getting that gentle movement is also going to help. If you can lay down after a C-section, so this question is it better to sit in a chair or lay down on the couch to relax? I probably would lay down if you can. It is just kind of painful to go from laying down to standing with a baby. There's just a lot to do. So sometimes if you don't have a long period to lay down, you might just stay in the seated position. And then we do have an Amazon storefront where there's a lot of these links as far as the silicone cups and the sheets that we showed in the webinar. So this silicone sheet, just to show you a little bit more, is just this little flimsy piece of silicone. You peel it back like this, and then you would put that directly onto the scar. You probably want to wait till about at least 4 weeks. It is sometimes hard to do the C-section mobilization. So I use this often when I know that I'm not going to be really diligent about it. So I even use this now, and I'm almost 3 years, well, I'm 2.5 years post the last C-section. So I put this on the C-section scar here, and then you can put a piece of tape over. So this is kinesio tape. You could use any kind of athletic tape to put over it, but this just helps the pants not catch on that silicone pad. So again, you just put that on, stick this guy on nice and flat. I'm not going to be able to do it because I'm showing you guys. Stick that on nice and flat over the top. And then off you go. It does its mobilization for you. Sometimes too, when you mobilize, it can be a little bit sore. What you want to do is you want to drink water, take vitamin C. If it's sore for longer than 48 hours, you probably overdid it. And next time, don't be so aggressive. And then recovering with toddlers, I think this is really, really, really tricky. So when recovering with toddlers, obviously there's a lot of demands on you, a new baby and a toddler. Having your toddler do as much as they can. So if your toddler is of appropriate age, having them climb up in their high chair, having your partner physically hand you the toddler. They say that, and you really shouldn't be holding them until about like 2 to 4 weeks, which is a long time. So a couple workarounds around that are, as you're nursing, having the toddler come and sit next to you as you're nursing. Another workaround is having your partner actually hand you the baby either while you're sitting or while you're standing. That way you're not having to lift them up. Having them like come and sit to eat if possible. Those are a lot of nice workarounds. Having a higher surface to change diapers. So having a partner put them up on the diaper changing station to change diapers are all really helpful things if you can't move around well. Just reading some of your questions. Okay, so C-sections and DR is one of the questions. What can we do differently to avoid that? So again, some of those gentle movements right in the beginning, really learning how to reconnect with your deep core, which is that transverse abdominal muscle, doing light diagonals. So in diastasis recti patients, they showed that people that did not have diastasis recti had actually nice beefy obliques. Our obliques are in charge of these rotational movements. So at first doing them with bands where it's not really loaded and we're slow and controlled and our chest and hips stay in one line with the band, then we can start to do chops where one leg's forward, one leg's back. Because I will tell you, I had 3 C-sections and didn't have DR. And I was like, oh my gosh, everybody needs to do the postpartum guide. Then I started running fast like a year after my last C-section. And that's when I opened up a DR at the belly button. So as I started to do that more impact rotational training, running is really a dynamic sport. So it can be really hard on that C-section scar. That's what opened up the DR on me. So then I had to close it again myself. And when it's okay to start lifting weights, usually you're waiting till about 6 weeks. And again, you're looking for that physician clearance. And there's a question about C-section number 2 being more painful, recovery, any tips for that? So I was so frightened for my 3rd C-section because I had been through the C-sections and knew how painful they were. Honestly, it got easier for me each time because I knew how to manage it. My 3rd C-section was like the least painful C-section of all 3 C-sections. So I think that can be really helpful in people preparing for C-sections when you're so nervous about the C-sections. And this question, does it get harder to mobilize the scar with each subsequent C-section? The answer is yes, because there's been more impact and trauma. One thing that would be helpful is having your physician clear out any C-section scar tissue that they see in there. They can actually take that out before they reclose you. So again, that's something that you might want to talk to your physician ahead of time. How long does it take to mobilize a scar? Well, one of my patients that came in and I told them all my little tips and I was like, okay, can you please mobilize your C-section scar? She came back in a couple of weeks later and it looks so much better. And I was like, oh, this looks amazing. And she's like, yeah, duh, I just told you to do what you told me. And I was like, how did you fit this in? She has 3 kids. She's so busy because sometimes I don't listen to my own advice as well as I could. And then she literally just did it at night before bed. Like to me, I had to like send myself a Google Calendar reminder, set aside a time where I was not bothered by it. But I was like, duh, just right before bed, you're laying there anyways. It's so easy to do. It only takes 5 to 10 minutes, if that. And think about it. If you do something, it's better than not doing anything. And then we'll probably just answer a couple more questions here. When is it okay to run after a C-section? A C-section definitely delays probably your start to running because of the abdominal control that it takes. We just did a blog post that has tests that you need to be able to pass or pass most of them before you start running again. So with C-section moms, you'd really want to pay attention to that abdominal wall test and your abs testing before you start that. Okay. So best way, and this will be the last one, but best way to get baby out of crib after a C-section, you definitely want to have them as high up as a crib or bassinet will allow you so that you're not bending as far forward. You can ask for help so that person can hand the baby to you. When you don't have that option, you can use a step stool or a stool right next to the crib. So the shorter moms can step on the stool, keep your back hinged because we want that hip hinging going on to be able to grab baby out of crib or bassinet so it's less pressure on a C-section. Also using a technique, Julie Wiebe, that is another women's health physical therapist, kind of coined this term, but it's called blow before you go. So inhaling, bending forward, exhaling, picking baby up so that we're using that core pistoning system that creates stability. It protects our spine. It would protect the C-section scar. So we're using that instead of just bracing. Holding our breath can again put a lot of pressure downward on that C-section scar. You guys, I can't thank you enough for joining me. Hopefully you grabbed tips and tricks and useful information in here that you guys didn't know before. And best of luck with your recovery. We're excited to support you.